So WHO has a flagship program which is on digital health. It means that that's a key priority for WHO, and this came before the COVID pandemic. So we are very clear that digital health technologies has a key role to play in evolving health systems and health systems being able to adapt to changing needs of the population. So that's very important for us. Currently, WHO Europe is really working with countries across the region, in the 53 countries in the region, to really make this happen in all countries, not only in the European Union countries, but beyond those countries. And some of the key elements, there is a group bringing different types of stakeholders together to really contribute and have their perspectives from different countries to make sure that we are responding to the needs and we are accelerating and advancing digital health implementation in all countries. In addition to that, last year there was a big regional conference in Porto on digital health, and that was a great opportunity to listen to countries and better understand what the digital health needs are, so that we are able as WHO to really respond and support countries in advancing on the digital health agenda. Another key component is, from a health workforce perspective, is the optimization of the health workforce, the performance of the health workforce. And that means that we need to make use of the digital health technologies in order to maximize the limited human resources that we have, so that they can really make a contribution to patients' health and patients' outcomes. Climate change is becoming increasingly important, as we can see, as at the central political agenda at the moment, and the health implications and repercussions of climate change on health are really important. So WHO is taking this really seriously. In the last COP summit, WHO played a critical role, and at the regional level, we have the Budapest conference last year as well, where this was a central issue. WHO has an office in Bonn that is really dealing with environmental health and climate change. And now we are working closely, the Health Systems Division with the Bonn office, in really bringing health systems into the whole debate on climate change and health. And one example, for example, is green hospitals. And that's something that governments are starting to think about now, because hospitals and health infrastructure really play a role in increasing the pollution. And so we need to really move into greener hospitals, and we are working with countries in that direction on how we can make a contribution from that side. On the other side, climate change also have an impact on health systems. So we need to take into account also how health services are going to change and the implications for the health workforce. That will mean that probably we need to upskill and reskill health workers so they are aware of changing, for example, epidemiological profiles, changes of diseases. What we are seeing with increase of temperature, that some tropical diseases may go back to Europe, and we need to train health workers in how to deal with those issues. We see, for example, with the heat waves during the summertime, that emergency services are really picking up in terms of services. So we need to reorganize services to be able to respond to that. So there are different dimensions that we need to think about, and that WHO is really moving forward now in really addressing those issues.